Codes can happen at any given moment in the perioperative process, including pre-op, intra-op, and post-op. It is important to be ready and prepared to assist and manage a code as a part of the surgical team. It is the responsibility of the entire surgical team to be aware of the patient's status and to identify a decline in their condition and stability. How to call a code. There are several ways you can call a code. The easiest and usually the most convenient way to call a code is to press the code button located in the operating room. It is important to identify the location of the code button in the OR that you are assigned to. Other ways to call a code are to call the front desk or to use the overhead paging system between the hours of 6 a.m. and 11 p.m. Other ways to call a code after hours, so after 11 p.m. before 6 a.m., are to call the operator, call the nursing supervisor, or call the emergency response number. During hours where other OR staff are not available, it is important to notify others within the hospital so that help may be sent to the OR. Any member of the surgical team can assist with compressions, and appropriate placement, rate, and recoil will all help in providing circulation to your patient's vital organs. Here are a few steps to help with effective compression. Step 1. Get directly over your patient. Use a step stool if necessary. Step 2. Put the heel of one hand in the center of the chest, then put your other hand on top of the first, interlocking fingers. Step 3. Push hard and fast, using force from your shoulders, not your forearms, allowing for chest recoil and compression. Step 4. Attempt to give 100 to 120 compressions per minute for adequate frequency. Thank you. There are several code carts located within the operating room. There is a code cart located by OR 3, OR 8, and OR 12. In OSP, the code cart is located in the substerile core. CVOR does not have a designated code cart. However, there are defibrillators in every room and medication carts available. The hybrid OR has 2 defibrillators and a medication cart that must be retrieved from the CVOR. Pads should be placed on the front and back of patient. The location of your pads may vary slightly because of the procedure. Do not place pads over an implanted device, such as a pacemaker, and try to avoid placing them over medication patches. There are 2 rhythms that are shockable: pulseless ventricular tachycardia, or VTach, and ventricular fibrillation, or VFib, pictured here. Non-shockable rhythms include pulseless electrical activity, or PEA, and asystole. In this case, continue compressions and medication management from anesthesia. The code leader, the anesthesiologist, will indicate the amount of joules to shock the patient using the Zoll defibrillator. After turning on the defibrillator, placing the pads on the patient, select the appropriate joules using the energy select up and down arrow buttons. After desired energy is selected, press the charge button and listen for the change in tone to indicate the defibrillator has achieved the desired joules. Before pressing the shock button, state "all clear" and quickly examine the patient to ensure there is no one touching the patient. Then press the shock button. Continue chest compressions. Other members of the team can continue chest compressions and alternate when fatigued. It is recommended that the compressor should be relieved every 2 minutes to prevent rescuer fatigue. During a code, other things such as obtaining IV access or a central line, pushing medication, and assessing the patient's pulse and rhythm may occur simultaneously. After defibrillation, resume CPR and continue to follow the instructions of the code leader until patient is resuscitated or expires. Nurses, please make sure you complete the appropriate documentation, including the Code Blue record, a safe report, and under occurrences in SurgeNet. Post-code duties include preparing to complete procedure, close, or transport patient, or calling pastoral care if patient expires, and returning the code cart to the appropriate location.